Hello, Jeff. I am Christina Veselak, and I want to welcome you all to a live interview with one of our long-term, wonderful, exciting alumni, Jeff Jones, of the Academy for Addiction and Mental Health Nutrition. And as you all know, we train mental health and nutrition professionals in how to address the biochemistry of addictive and mental health disorders. And today we're going to be discussing with Jeff how he has used amino acid therapy in his practice and what he's doing with it now. So, welcome, Jeff.
Thank you. Thank you. Thank you for having me. I appreciate it. So, yeah, the program that I took with you, your level one training, and I've said this a couple times, but it's really true. I took level one and I started it the first couple months, and I had too much going on, and but I was like, wow, there's something here. So a number of years later I came back, and I was so glad that I did. And that level one specifically was very helpful for me to rethink how I've thought about not only addiction but just mental health issues, and they're all connected, of course, by the brain, which
Well,
amino
they,
acids regulate. So,
they absolutely are. So, Jeff, what is your training and background, and what were you doing um, sort of in your practice when you started taking our programs?
yeah, s- so my training and background, the credential kind of thing is I was a licensed professional counselor in the state of Colorado, certified addiction counselor, interventionist, and I got a credential from your program, and I've gotten other credentials
Huh?
that I have kind of forgotten about. But in my practice, when I started your level one, I was working with a fair amount of individuals in early recovery, and all of them were voluntary. And I did have some involuntary groups that I worked with, but I was also starting to um, the very first family that I worked with was at that time. And I
Mm.
remember you had, like, at the end of level one, you wanted some case studies. And one of my case studies was this family. And it was a pretty amazing thing. So I really appreciate the information, but also your wealth of knowledge just in being a family therapist yourself.
Thank you, Jeff. So, what changed in your practice once you started integrating amino acid and diet therapy? Like, what happened with your clients and with you?
Yeah, yeah. Well, a number of different things. Some people, it's like it was a game changer. So
Mhm.
that's just black and white. For some people, it was a game changer. For other people, it was more of a process of, maybe they felt I was trying to convince them of something that I was passionate about. Um, And so I know one of the biggest challenges that I had was this dilemma between, what we are told in the mainstream for mental health and addiction stuff, and, all of the research with amino acids that is not really all that easily accessible.
Nobody knows about it. Nobody's heard about it. Nobody understands what's actually going on in the brain with through the addiction process
Yeah,
and how depleted neurotransmitters drive the whole thing, and therefore how amino acids can so quickly turn around somebody's recovery journey.
yeah,
We've been doing this for decades.
yeah. Literally decades. And now it seems some people are just very apprehensive, and because I'm not an MD,
Uh-huh.
and I don't have those credentials, and they hear so much from, whether it's an outpatient program or a treatment center or whatever, about, the pharmaceutical
Mm.
approach. And what I want to, me personally, I am a both and kind of person
Yeah,
because
yeah, me too.
as you remember, last fall I got pneumonia and pharmaceuticals saved my life. So yeah, exactly. And the way pharmaceuticals seem to come across as like it's the only one solution, and we know that that's not the whole truth. Or
See,
that's
that's the big problem I have with pharmaceuticals, Jeff, is not that they aren't useful and even life-saving sometimes. But
right,
what they do is they tweak the brain. They don't actually feed the brain what the brain needs to function optimally. And what so many people don't realize, and I didn't realize, and you didn't realize until we were taught it, is that science has actually identified decades ago what nutrients the brain needs to function optimally, what
right,
happens when we don't get to our mental health and our functioning, when we don't get those nutrients on a consistent daily basis, and what happens when we do get enough of these nutrients, whether they
yeah,
be amino acids or vitamin B6 or zinc, right?
yeah,
This research was done decades ago, but I was never taught it in school.
right,
You were never taught it in school,
yeah.
right?
And then there's, Dr. Ken Blum's research with the reward deficiency pathway syndrome. And it's like, oh my gosh, when I started learning more about that, it just, and I saw so many people in early recovery kind of, and their only thing they could do is I can go to a meeting. That's all I can do.
Right.
And the sugar and caffeine and nicotine feed that. So
You know,
we have
that,
our
that that's right. And the field's talked about post-acute withdrawal for a long time, ever since Terence Gorski,
right,
started teaching and publishing. And it's a wonderful concept. It really helps to know that depression, anxiety, insomnia, irritability is a normal part of early recovery.
right.
Problem is that conventional treatment only has two solutions: go to meetings and
Yeah,
pray or take drugs.
yeah.
And you see,
And
what we know is that there's
yeah,
two biochemical drivers: low blood sugar and depleted neurotransmitters.
yeah.
One we take care of by eating protein every 4 hours. The other we use, and that actually helps rebuild neurotransmitters too. And then we take targeted amino acids. So we have the tools to turn off post-acute withdrawal within 20 minutes and
So
keep it away.
so Christina, this was, I'm not sure I ever told you this story, but several years ago, I was having lunch or brunch or whatever with a doctor, and I was having this conversation that we're having now, and he said something to me, and I probably don't have this verbatim, but it was like, we don't want these clients to be feeling too good too soon because then they'll leave our program. And I was like, and that just threw me for a loop, and I'm thinking to myself, but their brain is going to be working better. They're going to be understanding these recovery skills that program is teaching them
Yeah.
better when their brain works. And it's like,
Well, it is, but I mean, bridging the gaps, years ago was using IV aminos for people coming off opioids and other drugs. And
right,
they did find that after a week or two of these IV aminos every day, that people were getting so well so quickly that they were leaving treatment
right,
because they didn't understand. They thought it was a one-legged stool. Oh, I feel better. My brain's working. I'm cured. I can run off and live a happy life, right? This happened to me when I was working in IV amino, detox programs as well. People come back 3 months later and said, but I thought I was cured. Why did I just relapse? And we say, well, okay, it's a three-legged stool. It's biochemical, it's also psychosocial, and it's also spiritual. So, on the biochemical level, were you eating protein every 4 hours and taking your supplements? No.
Yeah.
Were you going to meetings and learning sobriety skills and developing a sober social group? No. Were you working on your trauma triggers? No. And it's like, well, of course you relapsed.
Yeah.
Three-legged stool here.
And
But come back. We'll support your brain again. And now you have a functioning brain to do the rest of your therapeutic recovery work, which, by the way, you actually do need to do.
so since I learned that from you about relapse and asking the first question of like, when was the last time you ate before
Mhm.
relapse? I can't like that's been 100% of people
Yeah,
saying, "Oh, I didn't think about that."
right.
And as a matter
Exactly.
of fact, I didn't eat that day at all,
Uh-huh. Yeah.
and it's like it's really difficult for people to put two and two together, and I think a lot of it has to do with the education that you're providing, on eatingproteinSavesLives.org and your main site. It's like that's not getting out there enough, or it's not being accepted, or other organizations aren't embracing it and incorporating it into what they do. I'm not sure.
I think it's too simple. People
Yeah.
simply can't believe, Jeff, that it's as easy as changing what you eat.
Yeah. So so Christina, so as like you sent me these posters and and I drop them off places, and and the question that I've learned to ask is supporting nutrition something that aligns with how you do, you know, re recovery here?
Right. Right.
Is support like is this a message that you align with? And so far, of course, no one says no. But then when I said, "Can these be put up here, like in your group room or
Mhm.
something like that?" It's like, "Oh well, there's a process, and I learn about the process."
You
So
learn about the process. And then they have to ask the doctor if it's okay to talk to people about what they eat,
yeah,
which doesn't quite make sense to me because doctors are never taught about how nutrition makes people healthier.
yeah, yeah. And I think the other thing too is what some centers have a dietitian. And
Right.
so what I hear is, oh, well, I will have to like, they'll have to take a look at this and okay this.
Yes, that's
And
right. And that's fine. I understand that because that's their resident expert. My concern is that regular dietitian training does not talk about what nutrients the brain needs to function optimally. And they haven't really connected the dots as to the blood sugar piece. And
yeah,
so the treatment program means well, and they hire a registered dietitian, and they trust the dietitian. The problem is that so many dietitians have not been trained in pro-recovery nutrition or what the addicted brain needs in terms of nutrient support and for restoring its
yeah.
optimal functioning. They
Well,
don't know. This is, of course, Jeff, why I have my school to
that's what
teach
I was
the
gonna say.
dietitians, to
Like,
teach functional nutritionists. Here's the specialty. Here's what your brain needs.
yeah. So my experience of being in your community, and I think you've trained 2 or 300 people or something like that. A lot of
Yeah,
nutritionists, like
yeah,
nutritionists aren't taught this, but they get it really
right.
quick. Once they do learn it, they really get it. And so it's really interesting to me, like in your community, there's medical doctors, there's nutritionists, there's therapists, there's other healing
Exactly.
type
Exactly.
people. And then there's people who are just curious and going, oh my gosh, this is amazing. I want to learn more about this. And
Right.
so it's just, it is like, I don't really understand quite why it isn't embraced and more people don't know about it. And when I see people relapsing over and over again, it is sad.
Breaks my heart, Jeff. Breaks my
So
heart. Especially when you ask them, they've been through 5 treatment programs. And did anybody tell you that missing a meal appears to be a #1 relapse trigger? And they
right,
say, no. Well,
yeah,
did the dietitian tell you this? No. Well, will you try it and see what happens? And they come back a week later and they say, OMG, right?
yeah, 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 right. And then they're a big advocate for it.
Yeah.
And I know for myself, I mean, one of the ways I've use this because of my own interest. I mean, I grew up in a family with addiction, and I was a child, and I've always been curious why the family piece is kind of gone missing, similar to this nutritional and biochemical piece has quote unquote gone missing. And so what I have learned from you in doing level 1 and level 2, I have, incorporated into a program for family members. So if family
So
members can start
excited.
to learn this,
Yeah.
then and the enabling word in addiction recovery, families enable, well, I would like, hey, they can enable health too,
Huh? They
healthy
sure
new
can.
patterns. And, that's just like a baby step. There's so many things that families can do to start to change patterns within their own body and within the way their family works.
Well, it sure can. And, my module in level 2, where I talk about codependency as a stress related illness, where so many of the symptoms in family members, the rigidity and the rage and the controllingness and all the stuff that makes us want to go, ooh, right, is actually due to depleted neurotransmitters,
Right.
depleted nutrients, and a very stressed out adrenal function. And once we address this biochemically, they can more effectively engage in their own recovery journeys as well.
Right. Right. And so, I have so much appreciation for you sharing that information. So, like what you're talking about, that info in level 2 is in my session 3, kind of, that I incorporated it into the program because family members the amount of stress in families over time, specifically for that one person who, they are not going to give up.
Caretaker. Yeah.
The caretaker, whatever label we want to put on them, but they're not going to give up. Their adrenals get toasted. They have GI issues. They have all kinds of issues that I learned about in level 2 of
Right.
of your training.
That's right. That's
You
right.
know,
So, so Jeff, tell us about your program with families. I'm really excited about it.
yeah. So I did a couple other programs, one in 23, one earlier this year. And what I did is I put all of that information online into, you know, I organized it all in one place for each
Hmm.
session. And, the end of this month, I will be doing webinars for, well, for families and for professionals who want to learn this kind of approach, which I call families first approach, you know. And, families can learn new information, they can start to incorporate it, and they can start to make their own changes. And of course, it comes with like online coaching, uh,
Hmm.
because we can't change just from reading a nice PDF or hearing a great
Yeah,
video and going, wow, that makes sense. But how do I actually implement it in my particular situation?
yeah, that's right.
So there's a lot of nuancing that. And what I try to do in these sessions is to let families know that they have choice. And
Right.
and you know, like in the past, because addiction has had so many different mixed messages, there's so much confusion, and it seems like we are given one definition. This is what,
Right.
do this. And
Hmm.
there's like, yeah, that can be good, but it isn't 100% going to be the quote unquote solution. There's numerous things involved. And so for families to get information about addiction, continue to ask questions about their particular situation and
Hmm.
implement it, and they start making change, then they can inspire new conversations with their loved one,
Yes.
and a new perspective of recovery. And when I say a new perspective of recovery, when family members understand this amino acid therapy, um, protein, eat protein first thing in the morning, every 4 hours, and what it does to the brain, the new perspective of recovery is just that, you
Right.
know.
That's right.
It's actually old information that has, not been available for the last couple decades.
Exactly. I mean, everybody knows that addiction is a psychosocial, spiritual disorder, but the biochemical piece of it has been shunted away into the medication and not talked about at all. Nobody's taught how to address the biochemistry
Yeah,
until this approach, until we have all learned this approach. And the wonderful thing about it, Jeff, is that it reduces shame and anger in family members as well as the people struggling with addiction themselves. Because
right.
once you really understand what's going on biochemically in the brain and what's going on nutritionally in the brain, the shame, like, oh,
Yeah.
okay, I get it now. And the blame and the anger and the what's wrong
Yeah.
with you? Don't you love me enough to
Oh,
stop? That
yeah.
goes away too, because it's like, oh, you have a starving brain. I get it. Now,
And
what are you going to do about it?
and so, the program that I have, it essentially, you know, well, that session 3 is your material,
Hmm.
powerful nutritional interventions, largely for the family to be able to calm their nerves with the biochemical piece of it, anyhow. And then session 4 is about power. And so you shared with me the slides you have about amino acid therapy and violence. And there's a video of you talking about the slides. So when family members really start to understand, you know, this third leg of the stool that you're talking about, and the relational dynamics, which include communication, interpersonal sharing of power,
That's
more
right.
of this, not always this,
Right.
you know, it's like, family members can be an asset to individuals getting into recovery. And it's not a black and white thing that family members can always do that, but I can guarantee you when family members are willing to change, there's so much
Mhm.
that can happen.
That's right. That's
And
right.
and this new perspective of recovery with, amino acid therapy, and it's like when family members bring that into the conversation, and a lot of the information that you put out in emails, I send out to.
Oh, that's wonderful. Thank you,
So
Jeff.
yeah, yeah,
Well, it's so important to get this information out there in sort of a grassroots way because it changes lives so quickly.
yeah.
Yeah.
Yeah, it really can. And, we know, I've seen it, you've seen it way more than I have, but what it does to an individual person's brain, and especially when they're combining it with other support systems like self-help groups or therapy, and they're changing their life and into passions, but then other people in their family understand that same concept and they are doing their own version of it, even though they
Right.
are not, getting DUIs or snorting lines or whatever the case may be. We live in a world where, hey, guess what this is? Here's my phone, you know, and we
Mhm.
can get addicted to looking at
Well,
it over, and we get dopamine hits that way.
we do, but so many family members end up turning to sugar and pastries for comfort food, right? Because they're hurting
Carbohydrate,
so much, and sugar fires the same neurotransmitters and is so comforting,
right?
right? And um, then, with again, we talked about stress related codependency is a stress related illness. Well, what else does stress do when we're not managing it correctly, when we're not getting enough sleep and eating properly and taking care of ourselves? We end up with obesity and heart disease and cancer, and we end up dying too. I mean, this is
Dying
why
early, and
dying early. This is why codependency has been considered an addictive disorder
right.
because it's progressive and potentially fatal.
I cannot tell you how many times I have used Gabor Mate's name and specifically the book he wrote, When the Body Says No. And there's so
Mhm.
much research in there about what happens, you know, to a person who lives in that stress for years, quite
Right,
frankly. And they
right,
can't say no, and they can't set an internal boundary with themselves,
right.
and that it's like we're addicted to the quick dopamine fix, as opposed to setting the internal boundary within myself and
That's
really having a discipline to do what I know intellectually is going to be better for me.
yep, yep, exactly. So Jeff, how do people find out about your program?
So going to the website, thefamilyrecoverysolution.com, at the very top, people will see the two webinars that I'm doing. One is for families, then another webinar for professionals. At the end of that webinar will be trainings that start in October.
Oh, okay. Good to know. Good to know.
Yeah.
And
So,
they are repeating. So if people happen to listen to this recording down the road,
right.
there will still be available training down the road, just as with, we are
That's,
offering ongoing training.
yes, I'm kind of like trying to follow the model that you've created with the academy. And Christina, how many people are in your academy now? Do you have a number? I always think 200 to 300, but
It's
I'm
just around, I think it's just around 350 people have gone through some of our training.
Okay.
And we have a good 170, 180 people in our active closed Facebook group for students and alumni. So
Awesome.
and it's a wonderful group, and you're in there,
Yeah.
and it's fun. It's
Yeah.
fun.
Yeah. And there's so much sharing of information and there's like a wealth of information in those Facebooks groups because there's people that have like a lot of information about this that I'm never going to know that much, but I can collaborate with them, or I can put a question in the Facebook group. So thank you.
Yeah, well, and that's why we've created our practitioner directory so that the public has access to all of you wonderfully trained people,
Well, thanks.
and you can collaborate with and refer to each other because, as you said, everybody has different specialties. All
Awesome.
right. Anything else you want to add?
I'm good.
Wonderful talking with you today, Jeff. Thank you so much.
You bet. Thank you, Christina. Bye bye.
Bye bye.